Hey everyone, my name is Dr. Ben Thompson, and I'm here with Dr. Ramsay Poindexter. We are audiologists with Treble Health, and this video is all about how to go through the process of getting hearing aids for the first time. There's a research phase, there's a contemplation phase, then there's an action phase, and then there's this retraining that happens in the brain. All of those stages are very important. And between Dr. Ramsay and myself, we have a lot of experience of helping people through this earlier in our careers in a clinic, the standard audiology procedure, and now with Treble Health via telehealth over the internet, working with hearing aids. So, Dr. Ramsay, are you excited to talk about this? Let's get right into it, shall we?
Let's do it.
All right. So first here is the research and contemplation phase. To watch this video, someone has gone online to look for information about hearing aids, hearing loss, or tinnitus. And the research and contemplation phase of hearing aids, especially if I've never worn them for the first time, it can take years. And what comes to mind, Dr. Ramsay, when we think of important insider knowledge on what to look for when we're researching different options for hearing aids? And also when we're contemplating, should I try this now or should I do something? What comes to mind?
Yeah, it's a really confusing market out there. We get bombarded with things on the internet. We see things on TV. There's just a lot of information. It's really difficult to consolidate that all into one place. So one of the things that we're able to do at Treble Health is to take that confusion out of the equation and to be able to sit and sit with you, for example, the patient, and to go over the history and come up with what we would think would be the best option for you. So sort of taking out the stress of what to do. There's all these things that are out there and available, and what is going to be best for me? Well, that's our job. That's for us. We all come in with a lot of experience. I myself have almost 20 years experience fitting hearing devices, and have also, worked with manufacturers on the other end of it. So I really understand the technology and what's going on with these devices and how that they're able to help you. So the first step really is to meet with an audiologist. Perhaps it's one of us at Treble Health, and let us help take that stress off of you and help us guide you as to what the best solutions might be for the hearing loss.
And yes, I would add to that there's this contemplation of, should I try to do something about hearing loss? Maybe I've received signs from family, friends, work that I'm missing words, or I'm asking others to repeat themselves, saying what, and asking my spouse to speak louder or say that again. And these signs, once or twice here or there, it's no big deal. But when they are consistent and constant, it adds up, and it can create this, this movement of, okay, I need to start thinking about what are my options. That's usually what leads to someone's first hearing test. And then there might be weeks, months, or years before someone decides, hey, I may want to try hearing aids because that was recommended to me. So there's this big educational component about learning, and then there's research into what should I do. Hearing aids are a strange medical device where, yes, a doctor recommends something, but you can also buy it directly online. And the way that we work as audiologists, as hearing doctors, is by trying to give you the best information and access to both online and in person. So that first phase, research, contemplation, it's important, and it probably led you here. Now, Dr. Ramsay, talk us through, in your experience, when someone tries hearing aids for the first time, what are the common misconceptions people might have, or things that you had to constantly find yourself counseling and communicating about expectations with these devices?
Yeah. So just adding on to what you said, once a patient is ready to talk about the solutions that are available, it's really important to keep in mind that devices or hearing aids are all on a trial basis. So these are all things that you do have the ability to try. And if it's something that doesn't work for you, you're not locked into it. So I think that's also really important for patients to understand. So probably the biggest misconception with hearing aids is that once I have these hearing aids on, everything's going to be clear and it's going to be perfect, and it's just like my vision. I'm going to put my glasses on and my hearing's going to be back to completely normal, and that's typically not what happens. We've come a long way, at least in my career, of watching the technology growths in hearing devices. And we're getting there. The products that are being released are better and better each year, really focusing on clarity and helping in those more difficult environments that you might be experiencing, whether it's, small dinner parties or whenever there's other noise. We really are doing the best we can to provide good solutions in those more challenging listening environments. But it's really important to know that these devices, as sophisticated as they are, they're not perfect. And so it's really important to have realistic expectations and know that there are just some situations where it isn't going to be perfect and it's not going to be perfectly clear. I think that's really important in the beginning stages. As patients are wearing their hearing aids and they start to get used to wearing them in different environments, you start to pick up on things and strategies that might help in the more difficult listening situations. And there are things that we can do and provide even extra support for the more challenging situations that aren't just one-on-one, include, some noise in the background. But I think the most important thing is for hearing aids is just to have realistic expectations, that it is not, it's not like glasses where the vision goes back to 2020.
And a big part of realistic expectations with hearing aids, and especially for the first time of wearing them, is understanding the timeline and this adaptation period that for many people who start to use hearing aids in the first few days, it does not sound good. It sounds weird. It sounds strange. It might sound metallic or like you're hearing through a speaker, or that there's an echo of your own voice. And all of those things are par for the course with wearing hearing aids for the first time. Now, if you did not know that and expect that, then it would create anxiety and disinterest and confusion and start to think, well, these things don't work. Well, from audiology experience, our job is to educate you on that journey and that process so that when these things inevitably do happen, you're not surprised by them. You can, go take them with stride and continue on. And that's really important for those who are trying hearing aids for the first time, to get through this 2 to 4 week period, which for many people creates these situations, whether that's hearing background noise very loud, whoa, that's really loud, too loud, or hearing someone's voice, it might sound weird, hearing my own voice, it might sound strange, just feeling like I'm hearing too much sound. All of those things can be adjusted through your audiologist, through us, for example. And those are all problems that can be solved, right? Dr. Ramsay, those are all problems that can be solved because physical fit in the ear is one thing, but the sound quality can be changed by the audiologist.
Absolutely. There is an acclimatization period. Typically, when we fit the patients, we need at least a week or two for the patient to wear the devices so that they can come back with feedback and say, hey, this water running, it was like Niagara Falls, or I was doing the dishes and this was happening. Well, we take all that information and we're able to go in and do a little bit of fine tuning in order to make the devices as comfortable as possible for you. Yeah.
After the initial adaptation period, it's still common to hear things in a new way, to need time for your brain to adjust to all the new kinds of situations you're hearing in. During that time, we recommend having close contact with the audiologist you're working with on our team, for example, because there are optimizations. We can make software changes. We can adjust the levels, adjust the bass, the mids, the treble, adjust certain features. And then it makes it easier. You can exhale and go, that is better. Thank you. The physical fit in your ears stays the same, but the sound itself can change. And then the first months, the first year of wearing hearing aids, okay, as time continues on, becomes very natural, just like glasses. You put them on, you put them in, you live your life, you don't think about them too much on your ears, and then you take them off. Yeah, some things people don't realize about hearing aids are that they're not waterproof, so you have to keep them clean and safe, and typically outside of a shower or being submerged with rain or water, but they do well overall if it's just light water here and there. They are water resistant. And then you can connect them to your smartphone so that you'll be able to take phone calls and make adjustments through the app. And those are all things that will also take some time to get used to and to make sense of. So Dr. Ramsay, I'll give you an opportunity to share any other insight you have about wearing hearing aids for the first time and some advice, and then we'll end this podcast session here today.
Yeah, I think in good summary, it's just important to understand realistic expectations. So we talked a little bit about that. The first few weeks, there is an acclimatization period. We might make adjustments just based on comfort. And then as the process go, we're able to probably make some changes to increase sounds that might have been more uncomfortable at the beginning, but the brain has made the changes. The brain's getting more accustomed to this different kind of sound. Ultimately, we hear from our brain, and the hearing aids are tools to help get that information to our brain. And over time, as we get used to what's coming in, what's being processed through these hearing aids and being sent up to the brain, over time, our brain is able to make the changes and to make good sense of that input, that auditory input that it's receiving through the hearing aids and reaching the brain. And we're able to make better sense of the sound, but it does take time. It's a slow process, as we discussed before, but eventually you're able to get there as best we can, and as best as based on what your auditory capabilities are.
Thank you, everyone. And I hope you enjoyed this introduction into trying hearing aids for the first time and what to expect with the devices, the brain, the adaptation period. Please reach out to our team if you want to continue this conversation with Dr. Ramsay, myself, or another one of our telehealth audiologists. Thank you, everyone. Bye-bye.